Okay, so welcome everyone to another deep dive with us. And you know what? Today is April 5th, 2025, which puts us right next to a pretty huge day.
Yeah, it does.
It's World Health Day coming up on April the 7th.
Yeah, that's right. World Health Day. And it was established by the World Health Organization, or, WHO,
Or WHO.
all the way back in 1950.
Wow.
It marks the anniversary of WHO's founding. So
Quite a milestone.
quite a milestone, yeah?
Yeah, when you think about that, it's like, wow, okay, this has been going on for a long time. And, as you know, each year focuses on a specific global health issue to bring awareness to it. And so today we're going to explore why World Health Day still matters so much. And we're going to look at how it impacts you directly. And we'll really get into the nitty-gritty of the importance of preventative steps for your health and the role of social care in all this.
What's really interesting here is that, the concept that your health isn't solely in the hands of doctors and hospitals.
Right.
It's a shared responsibility. It's something that involves each and every one of us in our daily lives.
It's so easy to think of healthcare as, oh, I only have to go to the doctor when I'm feeling sick. But all the stuff that we've been looking at really drives home the point that actively working to maintain your health is so key.
Absolutely.
So World Health Day has been around for over 7 decades now.
Right.
Why does it continue to be so relevant after all this time?
I think if we connect this to the bigger picture, the reason it's endured is because global health challenges are constantly evolving. So every year there's a theme, and that theme throws a spotlight on a really pressing issue that demands our attention, whether it's, new viruses, ensuring access to clean water, or the increasing prevalence of non-communicable diseases. It's like a yearly reminder that health on a global scale directly affects, your well-being.
It's like a yearly checkup for the planet's health in a way. And it really highlights for you that preventative health isn't just some abstract concept. It really does have a tangible day-to-day impact on your life, like the simple things, just regular checkups, something we all put on the back burner.
Yeah.
They can truly make a huge difference for you. And we saw some pretty compelling data on how early detection of certain conditions through, just routine blood work led to way better outcomes.
Yeah, no, that's a great point, and it raises a really important question.
What's that?
How do we as individuals and as a society shift from a reactive approach to healthcare?
Oh, okay.
Where
Interesting.
we're kind of, we only seek help when we're already sick, to a more proactive stance.
Interesting.
And, the sources we looked at, they emphasize that preventative health measures are really empowering.
Right.
When you understand the benefits of things like you were saying, early detection, you're much more likely to take those initial steps.
Yeah. And it's not just about what you do as an individual, right?
Right.
The role of accessible preventative health and social care services right in your community seems to be so crucial. And our sources discuss how these doorstep care services,
Doorstep care.
they can ease the burden on the traditional healthcare system for everyone.
Yeah, what's interesting to note is this concept of bringing healthcare closer to where people actually are. Think about it. Think about individuals with disabilities or those who have difficulty traveling.
Right.
Doorstep care includes things like home care services, being able to monitor your health remotely through smart devices,
Yeah.
and even having transportation to appointments arranged.
Yeah.
These things remove so many obstacles to getting the care that's needed.
It makes so much sense when you think about it just in your own life.
Absolutely.
People, in those regular health screenings, they mention like checking your blood glucose, glycosylated hemoglobin.
HbA1c.
Yeah, HbA1c. It's a measure of your long-term blood sugar control. And then there's thyroid panels, lipid profile.
Yeah, looking at your cholesterol levels.
Exactly. Hormones, PSA tests, prostate-specific antigen ECGs.
Checks your heart's electrical activity.
Yes, exactly. USG's ultrasounds.
A type of imaging.
Yeah. And then MRI scans.
More detailed imaging.
These aren't just for when you're feeling unwell.
Right.
They're really about catching potential issues in their early stages.
Exactly.
They're much more manageable.
Early detection often leads to more effective treatment and, significantly better long-term outcomes.
Right.
And if we connect this to the bigger picture, widespread preventative screening, across communities can reduce the impact of chronic diseases on individuals and the healthcare system as a whole.
Yeah. And this idea of holistic support that brings together your physical and your mental well-being, I think it really resonates with me.
Yeah.
It's not enough to just focus on the body.
Right.
Your mental health is just as important.
Absolutely.
And the sources mentioned monthly subscription programs that actually combine health support with social activities.
I saw that.
which I thought was so interesting.
Yeah.
It just sounds like a really valuable way to address both your physical health and, that huge issue of social isolation that so many people face.
And what's particularly noteworthy, I think, is the affordability that was highlighted.
Yeah.
Starting at around $19.99 a month.
Wow.
They even compared it to the cost of fish and chips,
Really?
really emphasizing that prioritizing your well-being doesn't have to break the bank.
Right.
And that social activities aspect is so vital. Combating isolation has such a profound impact on both mental and physical health.
And it's not just about you being able to access services.
Right.
It's also about having the knowledge to make informed decisions about your own health.
Absolutely.
And the sources really highlight the power of awareness in education.
Yeah.
Think about, online training programs covering things like nutrition, exercise, how to manage chronic conditions, stress management techniques, mindfulness,
Yeah.
even social skills.
Right.
That's all about empowering you to take the reins.
And this raises an important question about how easy is it to access reliable health information.
Yeah.
And they mentioned online CPD training for around £25
Okay.
with certificates that are recognized globally.
Wow.
That speaks to the potential for accessible and affordable health education that benefits everyone, not just people in healthcare.
It's about giving you the tools and the understanding to really be in control of your own well-being.
Exactly.
Because ultimately, and our sources emphasize this, your health is your responsibility,
It is.
both as an individual
Yeah.
and as part of a larger community.
Right.
We all need to support each other and make the most of the resources that are available.
And if we connect this back to World Health Day,
Yeah.
it serves as that yearly reminder to make your well-being a priority.
Uh-huh.
The sources suggest that if you're 40 or older,
Okay.
considering an annual health checkup is a good step to take.
It's a really good point. And it's not just for those who are already really focused on their health. The call to seek out local services for at-home health checks
Right.
or medical transport is so important for vulnerable adults or those with disabilities who might face extra challenges in getting the care that they need.
What's interesting here is this emphasis on reaching out to those who might be overlooked.
Yeah.
Services like accessible home health care and transportation
Right.
can make a world of difference in their ability to manage their health and maintain independence, and that benefits everyone in the community.
That's so true. And, for anyone listening who wants to find out more about these kinds of accessible healthcare services or explore ways to get involved, the sources point to a website,
Yeah, I saw that.
www.caresafe.io,
CareSafe.
caresafe.io. And it definitely sounds like a valuable resource.
It does.
So check it out.
Yeah, ultimately, this deep dive into the significance of World Health Day brings us to a crucial point. Actively participating in your own health journey isn't just about individual well-being. When we all take those proactive steps, we can collectively reduce the strain on our healthcare systems and foster a broader culture of well-being that benefits everyone in society.
That's a really good point.
It's about shifting from a system that just treats illness
Right.
to one that actively promotes health and well-being.
That's a really powerful thought. And as World Health Day approaches, maybe take a moment and think about just one small proactive step you can take for your own health. Maybe schedule that checkup you've been putting off.
Yeah,
Maybe look into some online resources, or even just have a conversation with somebody about their well-being.
that's a great idea.
Thanks for diving deep with us today.
Yeah, thanks for having me.
See you next time.
All right, bye.